So, welcome to the webinar on COVID-19 containment in Germany and reopening of the schools over there. So, my name is Ravi Kiran. I'm going to be your moderator for today. I'm one of the co-founders of Tudubuddy UK Limited. So, the guest speakers we have today are Mr. Martin Richter, who is a virologist, CEO of Public Health and Pharma Consult from Berlin, Germany. And the next speaker in line we have today is Ms. Katie Beatty, who is an international educational consultant on concept-based curriculum and instruction trainer. And she's also an author and school accreditor. I will give more briefing before they talk. So unfortunately, Ms. Julia Kinder couldn't join us in the last minute because of personal reasons. Sorry that I'm going to miss her today here. So this webinar is basically brought to you in association with Epistomo International School based in Hyderabad, India, which is a Vikas leadership school. And today we have 220 plus users. Some are on the Zoom call and some are on the YouTube live. In that, nearly 15% are parents and 35% are teachers, and rest of the portion is coming from the school management. So I hope it would be useful for them when the uncertainty is around the corner. And each speaker will roughly have 20 minutes plus, and then we will have 10 to 15 minutes of Q&A session towards the end. So any questions you have, please keep posting in the chat window. So we will move towards the end to those questions. And about Tudubuddy, Tudubuddy is a AI-based online platform to assess children from KG to year 8. We do conduct weekly championships to compete with their age group across the globe, which happens every Sunday. And this helps children and parents by identifying the learning gaps in the early stage. And Tudubuddy works with parents and school management in reaching to the children. So Tudubuddy has presence in UAE, India, and UK. Now I would like to talk about Mr. Richter, who is waiting for the conversation to start. So Mr. Richter holds a Ph.D. degree from Martin Luther University of Halle-Wittenberg. Currently, he is working as head of the unit in a scientific agency for the public health. He has been working in the pharmaceutical industry for last 15 plus years in various different roles. He is also an advisor to counter Bioterror and Biocrime unit. He worked as a principal investigator at University of Texas on highly infectious diseases such as hemorrhagic fevers caused by viruses such as Ebola, Arena, and Hantaviruses. And he has been an advisor on public health issues for World Health Organization and also ran numerous projects in highly pathogenic viruses and countermeasures in the African region. And he has 30 plus publications on his name on various topics like Ebola, HIV, and Hantavirus. So Mr. Richer is going to talk today on COVID-19 crisis evolved in Germany and which event had led to what responses in terms of positivities and negativities. Back to you, Martin.
Yes, thank you, Ranjit, for this kind introduction. And I'm very happy to be here today. And I will organize my talk in a way that I will try to be as chronological as I can. But as probably most of you know, there were many things, or still are many things happening today, at this moment, and in the past, that this will be impossible to cover everything. So I will focus on the events that are, in my opinion, most relevant. And I would start off in giving an overview of the situation in Germany right now, at this very point of time, at the moment. We do have, at this point, almost 200,000 cases that have been tested positively at some point. Of those cases, we have up to today a little bit more than 9,000 deaths, and we also have approximately 180,000 people who have recovered by today. The situation remains to be monitored on a daily basis from the Epidemiological Institute of Germany, which is the Robert Koch Institute. And you can get these numbers, if you're interested in the numbers for Germany, actually from their webpage. It's open access to everyone. And if you're interested, you can go look, and you have various settings that you can choose, cases per day, cases in total, cumulative cases, cases per 100,000 inhabitants, and so on. I advise it if you're interested. It's a very informing page, and if you want to keep track of the situation and how it's going on, then please be welcome to do this. And if you do, then you will realize that the case numbers are still on the rise, but also the cases for the ones from individuals that have recovered are also rising. So I guess to some extent this is positive news, and we were able in Germany to somehow really content the situation with the messages and the actions that were taken. And we can consider ourselves probably lucky that we were able to do this at such an early stage. But now, let's start from the beginning. As I said, I would like to do this chronologically, and we'll start internationally. I know the focus today is on Germany, but we can only do it if we look at the whole picture. And most of you, all of you know that the first reports were from a region in China, the Hubei region, in the city of Wuhan. And actually, at New Year's Eve, the WHO picks up a media statement from China, from the Wuhan municipal, claiming that there were several cases of unidentified disease that's having a respiratory tract effect. Couple days later, 2 days later, the WHO informs the Global Outbreak Alert and Response Network of a potential novel disease affecting the respiratory tract in humans in China at this point. Couple days, weeks later, the possibility of human-to-human transmission becomes evident and is also reported by the WHO. And as early as January 22nd, January 23rd, the WHO discussed a public health emergency of national concern among 15 independent experts on an expert board that the WHO calls such situation. However, up to this day, this was never unanimously declared. In fact, of declaring a public emergency of national concern, instead of that, this went fairly quick over the next couple of weeks to a pandemic, a declaration of a pandemic that was also declared by WHO by March 13th. So by March 11th, actually, and by March 13th, it was actually taken in by all the other countries that were affected, to be precise here. The epicenters of the disease and also the cases, not all cases display disease, we know this. So I want to make it very clear that the cases that are reported are not all sick. They are just positive for the virus. This is important to state. However, of course, in some cases, the infection does progress to a severe respiratory disease affecting actually the whole body. We call it a systemic disease, and manifesting itself mainly in the lung, as is the case for many pathogenic coronaviruses. The SARS coronavirus 2, as we call this virus, is a virus from the family of the coronaviruses. This is a family that has many members. Some of them are even asymptomatic to humans. Some of them cause a disease that we refer to as flu-like. And some of them cause severe disease. Not only SARS coronavirus 2 does that, but also the SARS 1, if you will. In the early 2000s, that one was discovered. And also in the recent years, the Middle East respiratory syndrome virus, the MERS virus, also can cause severe disease in humans. So SARS coronavirus 2 is not the only member of this family being able to cause severe disease, but it is also important to state that this is a rather large family of viruses, and not all of them cause severe disease. So let's switch to Germany in particular. And Germany had its first known case, one should say, in January 27th. So basically also pretty early, you should say. And there was one report of a guy who was tested positive for this type of virus. And this person, among others, was in contact with a Chinese delegation from the Hubei region, where also the city of Wuhan is located. And from there, the events now start to unfold. And in the beginning, and probably most of you remember, the risk of this becoming an event of concern was estimated to be rather low. And this went on basically in all January and most of February. But then we started to see more cases. And that basically started with the holiday season, the winter holiday season, where people from Germany took a vacation in areas that were later declared a hotspot, not at the point when they were there, but later declared a hotspot, and then returned to Germany. And that was one. There were many other reasons, but this is we have to focus on the most important events. There was one important event that basically led to the spread of this virus in Germany in particular. And those regions were in northern Italy and in Austria, ski resort regions. And basically, of course, there was also travel to other regions where the virus was already prominent, but these were the main ones that were responsible for the spread of the virus, for the outbreak, basically, that happened then later in Germany. And among that event, the officials realized that we did not have sufficient personal protective equipment available to hospital staff, to caregivers, let alone to the public, where this wasn't a discussion at that point at all. But simply the notion was there's not, and the reality was there's not enough personal protective equipment available. The hospitals, of course, have some of this in stock, and they are sufficient to work for a certain period of time. But if you constantly are using these, then of course you use them up at some point. And it became evident by March 3rd that efforts need to be taken to solve the situation. And that was later done, and the shortage of PPE could be overcome. So this played a large role with regards to the change in paradigm of preparedness and response to national health crises and epidemics, pandemics, and outbreaks of the sort. But I will speak about this later. Then shortly after that, March 10th, the crisis task forces of the Ministry of Health and the Ministry of Interior made the suggestion to cancel all public events that inhabited more than 1,000 participants. That was then, in the course of this pandemic, reduced to 50, and in some states even less, basically canceling all public events in general. And for that, it did not matter whether the events were inside or outside. This has been released now, but at this point where we're in time where we are now, around the March, April area, that was the case. And this is also the time when the officials realized that this will become a much bigger problem than that was emphasized in the beginning. Now, you do have to say that not only Germany, but many other countries, most of them, have never experienced an outbreak situation like this, where you have a disease that can spread easily from person to person, and in some cases causes severe disease, but not in all cases. So now you have to make the decision, what do you do? Do you protect the weak, or do you go about as usual and only make suggestions to the ones that are weak, that are accessible for the disease because maybe of their immune status, because they're elderly, because they're very young. Also, the very young don't have a very developed immune system yet. This develops over the years, and then by the age of 3, 4, it's almost there. And but before that, of course, these groups of population are also vulnerable. But the most vulnerable indeed were the immunocompromised, the ones that were basically on immunocompromised treatment for organic graft transplantation, for instance, because they're elderly, there's the immune response or the immune activity declines. It's a natural process with age. And those were, of course, also the ones, not only in Germany, but basically also in Europe, Italy mainly affected, Spain, then France, and then later also with regards to the cases, Germany. Those were the ones mainly displaying disease, and those were also the ones mainly dying from the disease. But it is also important to state that among the dead, not only in Germany, but also in other countries, are otherwise healthy individuals as well, who are not part of any of those groups that I just mentioned, who are regularly healthy, did not have any predisposition, not any disease that would cause this, and they are still affected severely. So what this tells you is that we simply do not know everything about this disease yet, which is normal as this is a new disease, and efforts are being undertaken to shed light on what's going on. But it is also important to state that this is not only the elderly and not only the immune compromised that are affected by the disease, but also otherwise healthy individuals. This is important to state. However, the main group of people is the ones that I've mentioned. As we move along, in March 13th, this is when for daycare units, for schools, the situation changed dramatically, because this was the time when basically all the schools and daycare installments in Germany were closed. And the jurisdiction about this, the responsibility about this, does not lie with the federal government as education purposes and many other things. But let's, for the sake of argument, stay with the education purposes, are indeed in the hands of the communities. And therefore, there were small difference in the time of the closure, but generally, after a couple of days, time after time, the result was that all the schools and all the daycare installments were closed. And we are now in the area of March 13th until March 15th. Some of them stayed open, as I said, a couple of days longer, but not much. And that was that. And basically, this is the situation up to today. A couple of weeks ago, now there was the Reinstallment Act that the schools and the daycare units supposed to reopen. And how difficult this can be, I'm sure other speakers will talk about, because I'm going to rely merely on the epidemiological background of the situation. And I just wanted to explain maybe a little bit why the closure of these units from an epidemiological point of stance does make sense. If you have a disease that's easily spreading from person to person during a time where you've seen as Germany, as a decision maker in Germany, where you've seen that other countries have immense struggles, and these are no third world countries that are struggling. These are countries that are neighboring countries or close to be our neighbors, like France, like Italy, like Spain, so just around the corner, so you will. So, of course, you have to recognize this and take this into consideration when you make a decision. And in order to contain or try to contain a disease which obviously spreads easily from person to person, it does not take much to infect another one. The infectious dose seems to be rather low, even though there are some cases that this can be disputed. But at this point of time, everyone had to assume with what was known at that time that the spread of this virus between one person that is infected to another was done by very easy means through droplets, and later on it became clear that it's not only through droplets but also through aerosols. And the difference between the two is if you get infected with a droplet, you are probably safe when you're like 2 meters away from the infected person. But if we're talking aerosol, you can get infected when you're in the same room with that person, no matter where you are. So now we're talking public transportation where people are in close proximity. So this, of course, is a concern. And a very good example for this route of transmission is the measles virus and also the pox virus. They all transmit via an aerosol and are easily infective. And that was then also reported for this virus. And if you want to contain something like this, you can only do it with radical measurements. As from an epidemiological point of view, only radical measurements will actually lead to the possibility, only the possibility to contain this. It doesn't mean that it will, but you have now the prerequisites to contain it through radical measures, radical closure, and then other installments that followed up this incident of closing the schools, like the mandatory wearing of masks in public places and public transportation and so on. So this is maybe a very important background to know of why that decision was made. Then, of course, we have to look on a political point of view, which I'm not going to talk about today, whether it is always the right way to look at this at a federal level, or look more in the municipalities, in the smaller areas that actually are affected. But then, of course, you will always have the problems of how do you restrict the travel from one municipality to the other. So you see, there's all sorts of problems, which is why this is then from a suggestive level, of course, handled from the federal authorities, and rightfully so, in order to contain these type of things. In the meantime, hospitals were getting ready to accommodate a lot of infected people that then may progress into severe disease, as we've seen from other countries. Fortunately, this, to the extent that we've seen in Italy and Spain, did not happen in Germany. Now, you can attribute this to the measurements that I've just explained to you, but we, of course, truly will never know whether we were just lucky or whether these actual measurements really did something. As I said, and in my opinion as an epidemiologist, to contain a disease, radical measurements are necessary. This has been done, and this was definitely, in my personal opinion, a contributor of why we got away pretty easy. And was there a question? No. All right. Let me continue. I have 5 more minutes, and then I should be done with everything. At the time of March 26th, it's probably also a nice fact to know, Germany was doing the most coronavirus testing worldwide. At this point, there was also the notion that the hospitals were lacking patients. Patients were not going into the hospitals for treatment for anything other than coronavirus because they were afraid of getting infected, and also there were not the resources in the hospitals to accommodate these types of people. So this all played a role in the Infection Protection Act, the second Infection Protection Act that was getting in effect later on. So the economical burden started to become deeper and deeper, and certain relief acts were then established, one for the hospitals, some for the caregivers, for the nurses, and so on. I'm not going to go into more detail as this is more a business thing, but this is also a very important thing. And another important date is March 28th. This is when the revision of the Infection Protection Act, the IFSG, that how we call it in Germany, was in fact. And I guess the main points, or the most important points about this revision of this act is that now fundamental rights such as individual freedoms as a basic right in a democratic society can be temporarily restricted for the sake of disease and outbreak containment to protect the most vulnerable of the population. And this refers to terms as quarantine and isolation of people. To distinguish the two, quarantine is for people who are suspected to have the disease but who are not sick yet. And isolation is for people who definitely show signs of the disease, who are definitely sick, who are known to carry the disease. Those are then isolated and treated in a hospital, whereas a quarantine can be in a hospital, but it can also be somewhere else, probably at home, if you will. It's possible there. It contains other things as the freedom, the restriction of freedom of assembly, privacy concerns with regards to Privacy Data Acts, family and home life, physical and moral integrity, and so on. So it's a very important and strict law that is affecting, of course, the way of life in a democratic society. But it is important to note that this is meant to be temporarily and only as long as the health crisis of national concern persists. To sum this up quite quickly. Later on, as we all know, we had a lack of disinfectants. That was then solved by really enabling a wide variety of businesses like pharmacies, for instance, to make their own disinfectants, and that rather quickly led to the mitigation of that problem. And then later on, as we progress in the disease, it became evident that there is a lack of nurses, a lack of caregiver personnel, and minimal wages were then agreed on, and other benefits for this type of work group. On April 29th, and then we're almost through, on April 29th, the mandatory wearing of face pieces was so-called community mask was mandatory in public transportation, indoor places, and the things that I've mentioned before. In some areas, it was also necessary to have these to wear these community masks in medical practices, in installments such as libraries, and a few other states and communities released stricter rules where you always had to wear a mask when you were outside or inside, except when you were at your home. So this was handled very differently from a municipality, one has to say. But basically, April 29th is the date when the mandatory mask wearing was, and is in fact up to today. In May, we are now on May 4th, we introduced in Germany also antibody testing, which is done to see if a person has been in contact with the virus and has maybe not suffered from disease, but has built antibodies so far. And this is meant to be used in conjunction with the nucleic acid tests that basically amplify genetic material of the virus, which is very sensitive and is more virus prone. And this is now supplemented with an antibody test to basically see how the population responds, because we know now not everybody gets sick. Most of the people do not get sick, and only very few have severe disease. And that's where we are at this point. And with regards to the school reopenings, let me just tell you this, and then I'm ready to take your questions.
Questions, probably we will take it at the end. I think please carry on. Yeah.
Sure. All right. And you see, you can really speak about this a long time. There's much more. There's much more to say, and very many interesting things for people who are not maybe familiar with the topic to know, which they do not know or cannot know, because epidemiological virology immunity is not an easy subject. It's definitely something that's not easy to grasp, and it's very, very important that we have sessions like this one, at least with persons like me, to try to introduce this to the population and give some sort of background of why certain things happened and why certain things did not happen. So we are now in Germany at the point where all schools and daycare are supposed to reopen to normal use earlier or by July 1st, if you take the whole country, some earlier, some later, but by July 1st. And in individual cases where there are certain hardships after the so-called summer break. And with all the installments, the requirements that the schools and the daycare have to fulfill, this is an extremely difficult task to achieve. So and this is my personal opinion, and I suppose that there will be amendments made to make the reopening easier in the end. It is very necessary to take the burden off of really the school districts, because they're not the epidemiologists. They, try to follow the rules, and they've done a tremendous job in doing so. So a big shout out to those of, teaching our children from home, making the videos. And I'm a dad, so I've been schooling my children. I have the utmost respect for all of you. I'm just so happy that I don't have to do it anymore. Let me tell you this. And with this, I'm done. I hope I could shed a little bit light on the situation. I could not cover everything, so if you're interested and you have particular questions, please feel free to ask them when we have the question and answer session.
Sure, Martin. Thanks a lot. It was really constructed very well from the start until the end on, the events and what has led and how was the response. So very insightful from a virology point of view. So thanks a lot for your time. I think whatever is not covered, probably we can focus into the Q&A time. So let's get into the questions time now. We only have like 5 to 6 minutes left. Only 3 minutes left. So I think there is a first question to you, Kate. How to maintain social distancing in the school when you have a big number?
Well, Germany is very good at rules. I remember when we first started wearing masks, there was a date that we had to wear them by. Martin mentioned that date, and everybody wore the mask and everybody social distanced. Therefore, there need to be very strict rules, and they have to be kept by everyone. And from what, our kids are very flexible. If we tell them to do things and they understand why, they will do them. So it's about the rules, really.
Yeah, people are very sensible in Germany, for example, so I think this is something, everybody should learn now in this context.
Understanding,
yeah. So, Martin, there is a question really on the social distancing. What is really reasonable? In some countries, they are saying 2 meters. And in the country where I live now, UK, now they reduced it to 1 meter. So what is really the right distance?
Yes. So as I said, as long as we are speaking about transmission via droplets, then a social distancing of 1 to 2 meters is sufficient if you don't wear a mask, that is. If now comes into the question also the possibility of aerosol transmission, and now it's a completely different picture, because aerosol transmission is just the bad guy in all of this. And the aerosol transmission in general, together with the droplets, just makes it basically a worst case scenario. We're just lucky that it's obviously not as deadly as of a disease as maybe Ebola is. Otherwise, you would be probably on our heels already. So, the distancing that makes sense here is what is proclaimed at this point. 1 meter, 2 meter. 1.5 meter is basically the main opinion when you have a droplet infection. You cannot take the aerosol transmission into account, because that would lead you to a distance it's not doable, basically. So, however, if in addition to all of this, now you wear the community mask, which of course is not aerosol tight, but it retains droplets, regardless of what you use. If it's just a scarf, or it doesn't have to be a surgical mask or even an FFP2/3. And we could do a whole topic on the PPE if you want, but I don't want to go too deep into this. So all those professional equipment is supposed to stay with the professionals, because we're short on them. That's why we're having community masks in place. They're supposed to be worn. So distances that are in place up to 2 meters is what you can go with. That's the most reasonable one, even though it will not protect you from aerosol transmission.
Yeah, sure. Thanks, Martin. So I think there is one question I'm sure Kate has covered to some extent. Kate, the question is, are there any special measures to take for the well-being of the children during the COVID?
Oh, well, that I could spend the next hour talking about that.
Maybe a couple of lines,
I think it's really important not to be too harsh on them and not to expect what we expected before from them. But parents are reporting that this new normal has been wonderful for their family lives, that they have seen their children not so tired and taking up hobbies, cooking, doing things at home that they wouldn't normally do. So if this is an opportunity for family life and for just taking a bit more time, then I think that is very good for children's well-being.
Yeah, thanks, Kate. I think what I can add one line from there is, as you said, a lot of families are also benefiting from this common time together. A lot of homes have picked up a program in the morning. Every morning in UK, a lot of people are switching towards a program called Jovix. He's online, and basically there is a session of physical fitness for half an hour. So those who want to try, try for it. Kate, there is a next question on the assessments. So what should the assessment be like for the remote learning from the school management perspective?
Yeah, that's it's a difficult question to answer. Shorter snapshots. You can't, if in your schools you expect students to take tests under time constraints where they learn and they regurgitate information, you can't expect that to happen at home, because that suggests that you are expecting the parents to be part of that assessment. So more assessments where they use their learning. So they've learned something and they have to use their learning to show their learning, will engage their minds in a more constructive way. So if you understand what I'm saying, so instead of just repeating what they've learned, you give them a problem where they have to use it and they've actually got to think about it. And in that way, the academic integrity issues are not going to happen in quite the same way.
Yeah, good. So basically the point is learn something and then apply somewhere so that, you really learn the concept rather than just learning for the purpose of learning. So I think we can just take one last question. We are a little past, sorry for that. So again, this is a question to you, Kate, I think. So what will happen to the students who are studying pre-primary classes? So where we give importance for, gross motor skills like hand and eye coordination kind of motor skills. How do we implement with social distancing in place?
Yeah, it's very difficult, and I have friends who are teaching very young children, and they are having great difficulty with it. Maybe this is an opportunity for more parent education as well, because it's something that I've thought over all of the years that I was a parent myself. I was a teacher, so I had an understanding of some of the issues that teachers face in school. So maybe this is an opportunity to offer sessions for parents where they are instructed in how to teach their children, because just expecting parents of young children to start teaching children, we will have this response. Which is, they're not teachers, they're parents, and that's why they send their children to school. That's why we have an education system. Otherwise, all children would be homeschooled.
Yeah, thanks, Kate. So I think we are done with the session. I would really like to thank everybody who participated, and also I am pleased and honored to share the dais with you, Kate and Martin. thanks a lot for your time, valuable time here.
Welcome.
So,
Pleasure.
I hope there is a lot for the people who join from India to take it from here and then apply in their daily lives, be it the school management or teachers or parents. So I would really thank everyone who joined today here.
Thank you.
Thank you.
So on this
Pleasure.
note, I'm ending the session. Thanks a lot.
Thank you.
Bye-bye.
Bye.
Cheers. Bye-bye.